Okay, Morgan, looks like you're on.
I'm here.
And I am on. I do not see any. Oh, Brooke. Hi, Brooke.
Hi, I'm here.
Okay, we do have a quorum. Okay, so let's see. Is this, Jeff, is this a special meeting or an emergency session?
Is Tammy on the phone? It is a special meeting
Okay,
for us to consider extension of the orders.
okay. So then call this meeting to order. And it is a special meeting of the Boulder County Board of Health. Today's date is Wednesday, October 7th, and the time is 1 p.m. We already confirmed the Board of Health members that are attending. And now, Jeff, can I maybe ask you to save time to read off the staff members who are on this call?
Yes, I will do my best here. I've got some folks who I can't tell who they are. So I see Chana Gassettis, who's on the phone with us, our communications manager, Indira Gujral, who's our communicable disease and emergency management manager, Barb Halpin, who's with the county PIO, Public Information Office, Megan Hatton with our Administrative Services Division, Kate Haywood, who's our county attorney, and Rita Mangan, who helped organize the meeting, works for Boulder County Public Health, Susan Motika, Director of Strategic Initiatives, Lexi Nolan, who's our Deputy Director, Trina Ruland, also County Attorney, and that's all the folks I see that are in the organization. If I've missed anybody, please announce yourself.
Hi, Chris Urbina here, Boulder County Public Health.
Yeah. I mean, you have the wild card.
And also, this is Jorge Santiago, Board of Health member.
Oh, hi, Jorge.
Hello.
Hi, this is Landry. Could anyone on the call who's not speaking mute their microphones? There's a lot of feedback here.
And Jeff, this is Pat O'Rourke. I'm not part of your staff, but you asked me if I could be available, and I'm here too.
Thank you, Pat. Pat, do you want to just announce your title as well?
Oh, I'm sorry. I'm the interim chief executive officer for the Boulder campus.
For the University of Colorado, correct?
Yes, sir, Jeff.
Thank you.
Okay, so this special meeting of the Boulder County Board of Health is now called to order. Notice of this meeting was posted on the Board of Health's website as required by law and included the teleconference number and ID so that members of the public could participate in this meeting. Because of the COVID-19 pandemic, obviously, and the need for social distancing, and in compliance with the current public health order, this meeting is being held online and telephonically as authorized by the Boulder County Board of Health bylaws. Okay, so who, I guess I'm assuming we have some public, and does anybody wish to make public comment?
Hey, Greg, can I make a suggestion? Just maybe
Sure.
want to give people the guidelines on public comment, how that's going to work during the meeting. We do have Megan Hatton is our moderator, so she can time folks.
Yep. So generally the way it works is 3 minutes of comments are limited to 3 minutes. I think initially we were thinking if we have, we'll take this first 15 minutes to take any comments. We'll see what we have left. And we can always kind of then jump into the meeting and possibly revisit public comment if we need to till the end. So I guess without knowing who, the chat function, if you have it, would be pretty helpful to say that, you know, or raise your hand. I think there's a hand raising function on here too.
And Greg, what if they're on the phone?
Say that, oh, if you're on the phone, Just feel free to introduce and request public comment. Okay, I'm not hearing anybody, not seeing any hands raised, and not seeing any messages in the chat. I think what we will do is we can always come back to that near the end, but for the sake of time, let's let Jeff kind of kick things off for us.
Excellent. Thanks, Greg. One ask I would have of board members too is if you're speaking, if you could just go on camera so folks could see who you are, that would be much appreciated. And what I'll do is I'm going to share a PowerPoint here, and then I'm going to talk about what we are here for specifically. So bear with me 1 second. Can someone just let me know when they can see that?
You can see it.
Okay, great. So as you recall, when we were at the board the last time and we passed the order, we said that we would be coming back to you before the order expired to give you an update on where we were in terms of our data and any considerations that we were looking at in terms of either extending the order, just letting the order expire, or deciding how we want to move forward. So we're going to present to you 4 different things today. The first one is I'll go through a data update and just share with you where we are currently relative to the outbreak, what that looks like relative to the state metrics. And then we're going to talk about a couple different things. Our mitigation plan was approved by the Colorado Department of Public Health and Environment last week. One of the things that we said we would submit as a follow-up to that mitigation plan was called Appendix C. And the purpose of Appendix C, which we're going to present to you today, is to go through and identify strategies that help us assure that we are keeping the spread of the disease down. So as you'll see in our numbers, our disease numbers are coming down. We are controlling the spread. And Appendix C will help identify strategies that will continue to mitigate the spread of the disease moving forward. The third thing that we'll present is 2 different orders. One order is going to focus on collegiate group homes, and the other order is going to focus on gatherings moving forward. All of this taken together is essentially our plan for how we're going to continue to monitor, control the spread of the disease as we move forward into the fall. And I want to just illustrate the importance of the partnership here. So what you're about to see has been in partnership with the University of Colorado. So they've been fully involved in the conversations, very invested in the process and supportive of it. We've been working really closely together. The city of Boulder is the other one that's been fully invested in this and working together with us. And the third one is Boulder County. So all of those partners under our area command are fully behind and supportive, and the strategies can't work independently without all of us together. So it's been a collaborative effort, and it'll be a collaborative effort moving forward in this process as well. And then we will be asking you to give us approval to, ultimately the ask that we have for you is to give us approval to issue the orders that we're going to cover with you today. So let me start by going through the data first, and if anybody who is not speaking, if you can just make sure you mute your phone, as Greg mentioned, that'll help reduce background noise for people. So this is I'm going to go fairly quickly through our data just so we can spend the time on the orders, which is really the area I want to spend most of the time on. But our total case count is up to 4,658 at this point. Unfortunately, we've got 80 folks who have deceased. We don't have anybody who's deceased as a direct associated relation to the outbreak that we have been managing. So I do want to make sure I'm saying that. This next slide shows you what's happening across the state. And the reason this is important is because the state in general is seeing spread among groups that are outside the age group of 18 to 22 now.
Jeff,
Sorry
to interrupt. This is Morgan. I don't think the slides are advancing, or at least they're not on my screen.
Okay.
Nope.
All right, hold on. Bear with me for a second. I'm going to pull it back for a second, and then I'm going to put it back up and see if that makes a difference. So just bear with me.
The suppression slide.
It should be, yeah, suppression transmission before holiday and winter surge.
Yeah, we can see that.
Okay, was that a delay?
It was a long delay if it was a delay.
Okay, all right. I'll just make sure that I'm trying to advance a little early so that the delay is minimized. And if you could just let me know again how long of a delay there is, I'll make sure I adjust for that. So what this slide shows is that we had two different peaks in the state, and this is relative to the context of what I want to talk about with the CU surge, but also cases that we're seeing slowly increase in other age groups. We saw a similar surge when social distancing got lax around July 4th. We saw another surge that's similar to that has happened since Labor Day. I'm going to show you a slide that projects a little bit more on that as we go forward. This right here, and let me know when you see it. It's going to show you a metro graph. It's the Denver Metro COVID-19 new cases by county, the 7-day moving average.
It's visible.
Thank you. So what you'll see here is on the red line, this is Boulder. You can see that we went through the previous outbreak that we had in the middle of the summer here, which was really tiny and minimal comparative to where we were here. This was a significant surge. It's considered the largest outbreak in the state. You can also see that we've controlled that surge and it's taken a lot of in-depth work to do that with partners. But we are now driving it back down to more where our historical rates were, which were one of the lowest in the metro region before we got to the point where this surge was in place in front of us. So our numbers are going in the right direction. We expect our incidence rates to continue to come down, but we're not quite where we need to be yet, and then we need to maintain this. This just shows the number of, and it's probably going to delay, so number of Boulder County residents and CU affiliated residents that are newly reported as testing positive or are considered probable. And what I want to call your attention to here is the light blue is the CU and CU affiliated cases. And you can see that we had a significant outbreak that occurred, and we are now down to very few cases in the CU population, which is exactly what we want to see. Our numbers on the bottom, the dark blue, are our cases that are happening in the other age groups across the county. You can see that we've had a little bit of an uptake. This is what's consistent with what we're seeing in the rest of the state right now. And I'll talk a little bit more about why that's happening in a second. What you should see in a second here is a 5-day average number of new cases in Boulder County among county residents. Just shows you again, very high peak. This was extremely resource intensive. Can't emphasize that enough. We do not want to be back in that place again. That was extremely taxing on our system. Still continues from a resource perspective to be very resource intensive even right now, as we still have a lot of investigations open. This is the trend in 2-week cumulative incidents in Boulder County by age group. What you can see here is clearly what we based the first order on, and we showed you previously. It is the 18 to 22-year-old category that is driving the majority of the outbreak. And you can see that it peaked here, and we are driving our incidence rate down. We are now down to just below 1,500. It is headed in the right direction. We want to get it all the way down to the bottom, and we want to maintain it there. The reason that is working well is because our students have really stepped up and taken responsibility for the behaviors that are necessary to drive that down. I want to say thank you to all the students who took paid serious attention to this, took responsibility, and changed behaviors associated with it, because that's what's allowing us to be on a downward trend right now. This is our 5-day rolling average percentage positivity rate. And I want to make sure I'm noting here, if you look at the state's dial website, which I have talked to you about before, and I'm going to talk a little bit about in just a second, that website shows a different rate, and that's because the one on the state's website is 14 days. I have been reporting on the 5-day rolling average because it shows us trends that respond more quickly than a 14 days. So when I'm presenting to city councils or to you, I've been showing you the 5-day rolling average. Our number on the state's website is below 5%. But this number will show a lower percentage because we're using the 5-day rolling average on this graph. These are our hospitalizations for confirmed COVID-19. And you can see that we are having a slight uptick in the hospitalizations. This is something we absolutely want to keep track of and keep an eye on. What we're hearing from our hospitals is we're not nearing any kind of capacity issues. This is when we were in capacity issues, was up over here when we were in that the major part of that outbreak. We don't anticipate, and the state doesn't anticipate, that we are going to exceed ICU capacity or hospital capacity moving forward, but it does come down to the amount of social distancing that people are willing to follow, as I'll illustrate in a slide coming up here. This is the statewide patients currently hospitalized for COVID-19. The blue line is confirmed, so you can see that there was a downward trend, a bump up. This is where the governor put in some more orders. He put the mask order in place at this point, and bars, and he put the order on bars in here as well. That started to drive trends back down, along with social distancing, and we're starting to see a little bit of an upward trend, so wanting to control that, obviously. This is the social distancing graph that I was saying that really demonstrates the challenge for us. And what we know is, if you look at the green line right here, you can see this is the projection with a 59% social distancing. And if you think back to when we were at stay at home, we were at 75 to 80% social distancing, or in that range. So we're down in this range now at 59%. And there's a fine line, as you can see, between the 59% versus a 66%, which really lowers our trajectory relative to current hospitalizations. The actual observed is much higher, which means our social distancing at a statewide level is less than the 59% at this point. This is an important graph because it's going to come down to assuring that people take actions, follow the orders, make sure that that we are social distancing of at least 6 feet, that we're wearing masks, doing good hand washing. That's what's going to keep this graph down. That is what drives this graph up and down if you look at the historical trends in Colorado. So social distancing is really important, and that's absolutely true for the CU outbreak as well. We know that the majority of those outbreaks were coming from parties that were occurring off campus, and even the on-campus students were that were becoming infected and positive with COVID-19. Many of those were being carried from off campus to on campus. This is the dial that I was referencing. Just to note here that we are judged by CDPHE based on that incidence rate in terms of where we would have to be on this dial. So we started out before we were in the surge with CU at this rate right here, safer level 2. Which meant our incidence rate was down in this range. Our incidence rate went all the way up to stay at home, and our incidence rate is now headed back down towards safer level 2, and that is our goal, is to make sure that we can at least get back to safer level 2, and our longer term goal is obviously to move to protect our neighbors. But we don't want to have to get shifted to another category. As soon as that happens, we're required to make significant changes in our community that impact our businesses. So instead of capacity limits of 50%, they would have to go to lower capacity limits. It limits gatherings. It has more of an impact on individuals, both from a physical health as well as a social and emotional health impact. And we don't want to be moving up on the dial. We want to be moving down on the dial. Our formal assessment with CDPHE will be on Thursday of next week to determine where we are at. And again, all our numbers at this point are heading in the right direction, but we can't stop. We have to be diligent and continue that. And that's what you're going to see in the orders, and you're going to see in Appendix C in just a second here. Key takeaways, I won't go through the things I've already said, but our mitigation plan was approved last week by CDPHE. Appendix C that we're going to present to you today is over here, and that is what we have worked on with our partners to make sure we have identified strategies for moving forward into the fall to keep this surge down, to make sure our numbers are staying low. As you know, we issued orders that are currently in place. That order is going to expire tomorrow, and we are going to be presenting with you 2 new orders, one on collegiate group homes and one on gatherings. The intention here is to slowly lift restrictions based on some specific measures and monitoring of activities, and we're gonna have Trina and some others go through that here in just a second. I also want to, at the end of this, we'll bring this up again, but we want to make sure that we have the ability to make amendments and changes to the order and to be able to shift levels that you're going to hear about in that order without having to come back to the board. We have made multiple amendments, as you've seen. We've kept you updated on the amendments we've had to make, but those amendments were necessary based on feedback we were receiving. So we want to be able to maintain that as we move forward so we can be flexible and responsive. And I'm going to stop there, and we're going to turn it over to either Lexi or to Trina, who's going to walk through the non-order portions of Appendix C, I believe, and then Kate and Trina will walk through the 2 orders, and that will cover all of it.
Great. Thank you, Jeff.
I'm going to pull back my slides. There you go.
Thank you. I'm Lexi Nolan. I'm the Deputy Director at Boulder County Public Health. Thanks for giving me a chance to talk with you today. We're going to take you through this plan for how we maintain some of the lower numbers we're beginning to see among the CU students and the broader containment and positive direction that we're working on in Boulder County. As a short overview, Appendix C really proposes 2 kind of key public health order changes. One relates to outlining new parameters related to gathering limits for 18 to 22-year-olds, the other to collegiate group homes. It also takes into consideration future thinking and planning around CU athletics and events and alcohol service. Going forward, we expect that masking and social distancing requirements will obviously stay in place. But as we began to think through some of the other issues around gatherings, we really wanted to use 4 guiding principles to develop the maintenance plan. And those principles were, the first one was a commitment from BCPH, the City of Boulder, and CU Boulder to continue to collaborate. The second is a preference for a step-down approach and gradual removal of restrictions rather than sudden removals, because we don't want to create kind of a opening the floodgates process. We really want to be helping people move to behaviors that are going to be part of our future for quite a while, and to do that in a gradual way as we begin to move in the right direction in terms of conditions related to cases in the community. The third principle is to really use a more focused and tailored approach as much as we can based on the emerging science and data and our specific conditions and contexts. The fourth principle is to develop a strategy for really proactively engaging the community and the students in particular in prevention and containment work, and to give students clear roles and incentives to achieve specific goals that are linked to increased gathering opportunities. So the first section of the plan, the maintenance plan, presents guidance for the next public health orders related to gatherings and collegiate group homes. And the second section addresses how that work will be operationalized within the current incident command structure and in an ongoing collaborative fashion once that structure is demobilized. The plan rests on continued collaboration to implement the actions and to develop new policy, for instance, related to athletics, alcohol service, inside dining as we move into the colder weather, holiday events, etc. And to also guide the implementation of the work through testing, data and surveillance, enforcement, and public messaging and education. So what we started with is the development of a set of metrics based on the state's DIAL framework, but specific to CU students. Jeff showed you just a minute ago the DIAL framework, and Trina will take you through the details of these gathering requirements in a minute. But the main point to understand is that what we created was a DIAL that was specific to the CU students and their situation right now, and that helped them to kind of move gradually through their own levels of testing, of incidence of cases and positivity rates in the community so that they can use a kind of incentivized structure to gain additional relaxation of some of the gathering restrictions that they're under now. So it was kind of a mini dial for the CU students in particular. And the intention is to really make that an engaged process with them so that they know where they are in that structure and what they would need to do to achieve relaxation of restrictions further, whether it's more testing in a given week, whether it's they've got to be more diligent about spread because our positivity rates are too high, et cetera. And so in addition to kind of general gathering relaxation, it would also allow them to begin to have more opportunities for participating in CU-sponsored events and other kinds of gatherings that we've kind of had to shut down so far. The three key metrics that Trina will take you through a little bit later include testing rates, positive cases, and positivity rates among the 18 to 22 population, but we'll also consider additional indicators in deciding whether we can move to a more relaxed gathering status that might include things like whether we're having other outbreaks in the county, what our surveillance testing rates are showing, what kind of violations we're seeing in the community, and as Jeff mentioned, the 5-day moving averages on specific metrics. And we're planning on having these dashboards updated pretty frequently so that students can really keep track of kind of where they are and engage each other in trying to participate in this effort. The second part relates to higher education athletics, and we're interested in trying to explore what we might be able to do in this space in collaboration with CU. So we're looking to work with CU to develop policies and a plan to support return to CU athletics, including practices and games. And this would probably include things like regular testing for athletes and coaches, possibly creation of a bubble, education and outreach to athletes and coaches, tracking of enforcement and compliance, things of that nature. The third section really relates to last call for service of alcohol. And as most of you probably know, the current City of Boulder's last call for alcohol service is 10 p.m. We're looking at how we can use improving conditions and the state's dial metric to develop a more graduated approach to releasing that time restriction as we go forward. The fourth part relates to regulation of collegiate group housing. And as many of you may remember, there was a particular part of the previous public health order that immediately issued a stay-at-home requirement for approximately 37 to 39 addresses in Boulder, most of which were collegiate group housing. Some of the addresses were on the list because of egregious violations, large parties and such. Those addresses have not had any violations in the last 2 weeks, and our intention is to immediately release them from stay-at-home based on their good behavior. And for the remaining group college collegiate group houses, what we want to do is recognizing that when students live together in large groups, there is a real greater risk for transmission of the virus. So we're asking them to submit plans for how they will prevent and control infection if they have a case in their house, and conform to kind of a checklist of agreements, including weekly testing, cooperation with contact tracers if they have a case in the home, limitations on visitors if they begin to have a problem on an individual house basis, and weekly check-ins. And once they have submitted an approved plan and agreement to these conditions, then we should be in a position to be able to begin to release them from stay-at-home orders. So finally, the last part of the maintenance plan really addresses the operationalization and implementation of the work. And it includes how we ensure that the transition from the incident command structure to a more informal structure is maintained, including in collaboration on development of policies and plans, as well as testing, data and surveillance, containment, enforcement, public messaging, and education in relation to really implementing all of this work. And I just have to say that so far we're feeling really good and optimistic about this collaboration. It's been an amazing effort in terms of everyone jumping in, contributing their skills, and really working together to really create a safer community. So I'd like to turn it over to Trina Ruland at this point. Trina?
Thank you, Lexi. Trina Ruland, Deputy County Attorney. I am going to speak of the first of two proposed public health orders that we are bringing to the board today. I'm going to speak about the public health order that we're proposing concerning gatherings for 18 to 22-year-old individuals. And then Kate Haywood will speak about a second public health order proposed about regulation of collegiate group homes. I'm going to share my screen right now to use this as a guide for talking about this public health order that we're proposing here. As Lexi mentioned, we're looking at a kind of step down form of order, which allows for less restrictions as long as the metrics support it. This is modeled on what we have on a statewide level right now for counties. What you see on our screen is what Jeff showed earlier, which is the statewide dial is how it's referred to, which is based on the incidence rate, the positivity, and the hospitalizations. The dial, so to speak, or the series of levels is what we're calling them to avoid confusion with the state order, will be based on the cases per 100,000, as well as the positivity rate and as well as testing goals for the 18 to 22-year-old population. So,
Hey, folks, just a reminder, can everybody mute that's not on the phone or that's not talking?
Thank you. On your screen now are the list of metrics that we will look at for each level. The current public health order is really meant to align with level C here, where cases per 100,000 are in the 1,500 to 2,000 range, positivity rates between 10 and 15%, and we are getting consistent testing. Level D is really a level we don't want to have to go to. That would take us to something similar to stay at home, but it is there in the event that we do see a secondary surge. The goal here would be to move from the right side of the table toward the baseline. And the baseline is where we want the 18 to 22-year-old metrics to ultimately end up. It's what we saw pre-surge, at which point we would no longer need restrictions on gatherings. And just for comparative points, our cases per 100,000 among the 18 to 22-year-old population spiked to about 3,500 at the peak. And I don't know what they currently are, but I believe they're somewhere in this level C range. And same thing with the positivity. What the levels correlate to are the amount of people you can have in a particular gathering. And actually, before I get into that, I'm just going to clarify this public health order we're proposing. We would see a first evaluation of a move between levels on October 13th. We would be starting out at this level C, which is consistent with what the current public health order has in place. So there wouldn't be any changes tomorrow when the current public health order expires. Rather, we would see continuation of the current levels and then an evaluation on Tuesday of next week to see if we might be at the situation where we could move to level B. Public health would evaluate the metrics that I identified, as well as some of those additional secondary metrics that Lexi identified, in order to see if it would be appropriate to move to less restrictive measures on a no more than weekly basis. We'd be looking at 14-day rates for those cases per 100,000 and 14-day rates for positivity. In order to make sure that things aren't slipping backwards, we'll also be looking at 5-day rates in case that we are going in the wrong direction. We want to be able to move quickly. In order to move from level C to level B, for example, you would have to meet all 3 of these metrics here. So what these metrics get you are slowly decreasing restrictions on gathering size. And we've broken out gatherings into really 3 components. Personal social gatherings, that's the hanging out with friends. And these all only apply to the 18 to 22-year-olds, consistent with the current level. Personal social gatherings, those are really the hanging out with friends, the going over to someone's house, the exercising together, shopping together, etc. That's really limited to 2 people right now. And if we get to level B, it would be a bump up to 4, then to 6. And then once we're at baseline, there would be no restrictions specific to 18 to 22-year-olds, and it would all go away, and they would be under the same restrictions that everyone within Boulder County is under the state dial level. Dining is pulled out separately because I think this can be a point of confusion. It's the same as the personal social gathering size, but we're pulling it out specifically because when you are dining, you must remove your mask. So we want to be very clear that under these different levels, you're really going to be limited to the number of people that you can dine with, really to reduce the risk overall. Where we see the most significant change is between level C and level B. Once you move into level B, the 18 to 22-year-old population may participate in what we're calling regulated gatherings, which probably most significantly will include CU-sponsored recreational or social events, which could be conducted up to current safer at home level 2 levels. So what that would allow for is for CU to organize, for example, a movie on the field where students or 18 to 22-year-olds can come in. They are wearing face coverings, they are socially distanced, and it's a relatively low risk environment, but it's also regulated. It would also allow the 18 to 22-year-old population to participate in businesses that are offering classes or gym classes, among other people. Yes.
Oh, sorry. Oh, sorry. I had a question, Trina, just to clarify.
Sure.
On the dining for ages 18 to 22, does that number include just the number of people who are 18 to 22 years old? So if an 18 to 22-year-old was dining with, say, 2 of their parents, do that, or does it apply to just the people within that age range?
So does
that make sense?
Yes, that absolutely does make sense. What happens if you're 22 and you want to dine with 23-year-olds? So the limit is going to apply if there are 2 or more 22 people between the ages of 18 and 22. So if you're a 21-year-old and you want to dine with your parents who are coming into town, you may do so. But if there are 2 people between the ages of 18 to 22, then you would be subject to these limits here. Did that answer the question?
It does, yeah. So thank you. It does, yeah. So 2 people plus within that age range right now is allowed, plus however many additional people outside of that age range, but no more than that.
Well, once you have 2 people in the 18 to 22-year-old age range, then these limits apply and you don't add in other people from other age ranges. But if you only have 1 person in that age range, then you add in other people from the age ranges under CDPHE limits.
Okay.
And if that's something we want to have further discussion about, we can certainly do that, but I would have to defer to Jeff on the policy decisions around that. So that's the basic structure of these levels. I want to just highlight a couple of things that exist in the current order that will stay the same and a couple of things that will change. We have some exemptions from the definition of gathering in the current order, such as CU in-person learning. That will stay the same. Exempt from the definition of gathering is also when someone is acting as an employee for a business or a nonprofit. That will stay the same, so that employers don't have to go through any special conditions or regulations. They normal CDPHE requirements for employees. For CU athletics, that will be exempt from the definition of gathering in order to allow the university to make specific proposals to public health and receive approval for those proposals to allow NCAA athletics to proceed kind of separate from this dial. We will also keep in the order the requirement for CU students to continue to monitor symptoms and cooperate with contact tracing. And finally, the time period that we're proposing for this order would be through December of this year, at which point we propose coming back to the board for either an extension or a modification of it. And that is all I have on this order, unless there are any additional questions. I'll turn it over to Kate, who will talk about collegiate group homes and that proposed order.
Can I ask one very quick question? For the groups that are under the stay-at-home order, will they will come off the stay-at-home order immediately and then move to level C? Or will they have to wait to be evaluated on 1013 as well?
So that is the perfect segue for Kate to pick up here.
Oh, thank you.
Awesome. Thank you, Trina. Before I begin, does anyone else have any questions for Trina? Great. Thank you all. So I have been working on what we are referring to as the Collegiate Group Homes Order, and the purpose of this order is to implement a public health framework for off-campus collegiate group homes in the city of Boulder in order to enhance COVID-19 prevention and mitigation standards within such facilities. For purposes of this order, off-campus collegiate group homes means off-campus residences where 5 or more students of higher education reside in a group living arrangement that are owned or managed by a third party that provides residents with housing and/or services. As supported by CDC guidance, public health has found that shared or congregate housing settings are at increased risk for COVID-19 spread due to social distancing challenges and use of shared equipment and facilities among residents. While certain congregate housing settings, such as assisted living facilities and on-campus residence halls, are subject to regulatory oversight and control by governmental agencies and bodies, which have the authority to establish stringent COVID-19 prevention and mitigation standards for facilities under their purview, other congregate housing settings, such as off-campus collegiate group homes, are not subject to any such oversight or control. Implementing an alternative public health framework for off-campus collegiate group homes in the city of Boulder will enhance COVID-19 prevention and mitigation standards in these facilities and better align such standards with other congregate housing settings that are subject to regulatory oversight or other public health frameworks. Implementing an alternative public health framework for off-campus collegiate group homes, which primarily house 18 to 22-year-olds, will assist preventing and mitigating COVID-19 transmission in Boulder County, as public health has determined that the majority of COVID-19 in Boulder County is largely among 18 to 22-year-olds in the city of Boulder. So with respect to the proposed alternative public health framework, it would take the following form. The public health order would require off-campus collegiate group homes to submit a facility assessment to public health that addresses the following items. First, implementation of COVID-19 prevention and rapid response measures as provided by public health. Compliance with weekly required surveillance testing for CU students through CU. Compliance with public health orders and contact tracing and containment efforts, required weekly check-ins with the City of Boulder to provide updates on compliance, as well as incidences of illness within the facility, and preparation and submission of an isolation and quarantine plan for ill and exposed residents. This order would come into effect October 8th at noon, and the current public health order, including the current gatherings limitation and stay-at-home requirements, would remain in effect through that time. For collegiate group homes currently under stay-at-home requirements, the residents of these facilities would remain under stay-at-home until the facility has submitted a public health approved assessment or until October 12th, whichever is later. And we would propose issuing this order for an indefinite time period until modified or rescinded by public health. And I'm happy to answer any questions that people may have.
Thanks, Kate. I've got a question for you. Has the county worked at all, or what is the plan to support these houses in meeting these requirements so that they can set themselves up for success?
Yes, absolutely. We are actively compiling as many informational resources as possible to, provide links in the order and through the application form. And then we will also provide contact information for staff that can provide direct one-on-one assistance to any facility that needs it. Any other questions or comments? Great. Thank you all for your time.
So to board members, I want to see if it's okay. I want to give Pat O'Rourke the opportunity to comment as a major partner here with us today. Just want to make sure he has the opportunity to emphasize anything we've talked about, because like I said before, we're not going to be successful unless we're working together on this.
So I'd be happy to, and I wanted to first thank the board for letting me come and chat with you for a few moments today. I also really appreciate the fact that both Executive Director Zayak and Deputy Director Nolan recognize that CU students have joined the fight against COVID in our community. CU students are part of the community. They live here, they work here, they patronize businesses, and they make the community vibrant. And so we're really pleased that we've had an opportunity to be able to engage with Boulder County Public Health and appreciate the fact that this order recognizes that COVID-19 is our common enemy and that our CU student population can contribute to the community's health as we move forward. The students are really asking for a couple of things. First is the ability to continue with meaningful educational experiences, and we know that they want to be able to resume classes. The proposed order allows for that, and we're currently working on a transition plan to be able to do that. We know that our classroom environments have been safe and that we haven't seen cases amongst our students, faculty, or staff from that educational environment, and really appreciate the fact that the order as drafted would allow us to be able to pursue that. We also am really grateful for Trina and others, including Indira, who came up with a framework that allows for increased social interactions if students are socializing safely, participating in ongoing testing, and participating in contact tracing. We recognize that we have an obligation to make sure that the testing is available and that our contact tracing capabilities are there in order to be able to keep the community safe. But more than that, as Trina outlined, the order as it's drafted will provide an opportunity for our students to take charge of the behaviors that contributed to the spike in the disease, and also to engaging in the right behaviors that will lead to change in a positive direction. By having a graduated approach that increases the ability of social interactions that may be available to them based upon success, we're really empowering students to make good choices, to take control of their own opportunities, and to be part of the solution. So that, in closing, I'd just like to say that we want to partner with you, with Boulder County Public Health, in supporting good practices and also support our students. They have chosen to be part of this community. They want to be good and productive students as well as members of the community. And that I'm really grateful to Jeff, Lexi, Indira, Chris, Trina, and all the others at BCPH for working with us over the past several weeks to be able to gain better control over the outbreak. And also thank the members of the board for their consideration of the modifications that have been proposed. We think they represent a reasonable and thoughtful approach to allowing for our students to have some greater freedoms, while at the same time sending the message that we're not out of the woods yet and we need to be maintaining vigilance and keeping the numbers moving in the right direction and at all times. So thank you for giving me that opportunity.
Greg or board members, do you have any questions of us?
I have a question about the testing. So when we've seen the fall off, have the testing, the numbers of students being tested, have they stayed consistent throughout the last 2 weeks?
Pat, do you want to address that?
Yep. So we've had some decrease in testing. That's probably attributable to two facts. Number one is that we had a portion of our student population who, when the order went into effect, and might have gone home to live with their parents or elsewhere. So our student population decreased some, particularly in the residence hall. We also know that as a result of the outbreak itself, that there have been a good number of CU students who have tested positive, and once they've tested positive, they're not part of the testing regime. We are going to continue to keep the testing protocols in place for all on-campus students on a weekly basis, and we have recently added the ability to do 600 tests per day of off-campus students, faculty, and staff. 450 of those would be available at the UMC on the main campus, and 150 of those would be available in the SEEK building on the East Campus. And one of the things we're in discussion with Boulder County Public Health is how to, as part of the relaxation of the stay-at-home orders for the congregate housing, is how to get that student population involved in regular testing protocols.
So there's no concern that the fall off that we're seeing isn't just decreased testing numbers, but actual change in behavior?
I believe that it is change in behavior is attributing to those numbers.
And I can add to that. So we are doing, we have multiple surveillance pieces going on that is happening weekly with both the University of Colorado Police as well as City of Boulder Police folks. They are patrolling the areas on the Hill where we know we've had parties in the past and challenges associated with that. It's consistently been reported that it's very low activity, so we know from a behavioral standpoint that those things are coming around. We're not seeing the same things happen that we did before. The university is also tracking referrals on disciplinary actions, and we can clearly see what the trend looks like relative to the disciplinary action. So we know that these strategies are making a difference in terms of those behaviors.
Thank you.
What's the rate currently for community members outside of the 18 to 22-year-old? So what's the rate of cases as compared to that 18 to 22-year-old?
I can't answer that, Morgan, but what I can do is I can show you the chart and just demonstrate the difference, if you bear with me for just a second, and then I can follow up with that actual answer, but I can show.
That's okay. Thanks. I guess I was just looking for a comparison point. I think a lot of the feedback, certainly that I have seen come through my inbox in the last couple of weeks too, is this idea that, that CU students aren't being hospitalized, and so why are we punishing them? And I know that there has been then evidence that there are increasing numbers outside of that 18 to 22-year-old range too, right? And you saw a little bit of uptick in the numbers. And one of the things I'm wondering is there a, in the contact tracing, has there been a link between the increased community members outside of 18 to 22 that they were exposed through the CU population? Or do we have any data to support that? Just wondering.
We don't have any data to support that at this point. There's still 200 and some odd investigations that are ongoing, so we haven't closed out the outbreak. But we don't have any data to support that. And again, when you look at the trends in our age group numbers. They're extremely consistent with the metro for sure, and also with what we're seeing at the statewide level. And that's been validated by CDPHE when we've met with them as well.
Okay, so we don't know whether or not like the increased numbers of CU students are bleeding out to the community or affecting our community rates.
Yeah, we don't have that confirmed at all.
Okay. And the community, I think I saw somewhere in the paper that was sent out, the attachment that was sent out, that the free testing site for the community is going to continue beyond, it was initially set to stop this week, right, tomorrow, and it's going to continue to be open and free to the community?
That's correct. So right now that testing site is going to be open through the 18th, at which point we have the ability to reevaluate that with CDPHE. CDPHE has been really great. They're supporting that financially for us. So they've been a great partner. And the rationale there is we want to just make sure we're not seeing any other generalized spread. The positivity rates for that site have been consistently less than 5%. So that site looks good. Great.
Thank you. I'm going to just continue with questions if that's okay, but other board members or others, please feel free to jump in, and because I just have a couple other questions. So I appreciate that the staff has really tried to work with CU and students in setting up a system going forward. It sounds like the desire, right, is to have students fully engaged in this, because I think, again, some of the feedback that I have heard in the community is that it feels like this is being done to CU students instead of in partnership to CU students, with CU students to try to address the problem. So, so I'm glad to hear that this is looked at as a partnership going forward. Were CU students, were they involved in setting up this new dial system? I mean, has there been an opportunity for students to respond, I guess, to this new step down approach?
Go ahead,
I can actually answer that, because we did have a meeting that Pat was able to facilitate with student leadership at CU, and we solicited their feedback on this proposal on a high level. I also have that graph that you asked for that Jeff was referencing right here, which compares the rates among the 18 to 22-year-old population with the rest of the Boulder County population broken out by age groups.
Great. Thank you so much, Trina, for that. I guess another follow-up question has to do with, do we know anything about how the mental health of students has been over the last 2 weeks? I know that was a concern that we talked about 2 weeks ago when the order first came to the board. And I'm just curious whether or not you've heard anything either from Wardenburg or others on campus as to how the 2 weeks of the order has affected students' mental health.
I can respond to that, which is we are seeing our students under increased stress. The lack of social interaction has been challenging for them, as well as the fact that they have felt like they are confined, particularly for those who are in isolation quarantine. Those are necessary from a public health standpoint, but we are seeing increased demands for service for student mental health services, and we're trying to continue to support the student community as best we can. But it would be disingenuous for me to say that this has not been a very challenging period for them, and that one of the reasons why we really do want to try to empower them to be able to have the increased social interaction and other opportunities is because that will help to mitigate those strains.
Yeah, I mean, I promise I will turn myself off here in a second. I think that continues to be, one of the biggest concerns for me, is just how can we support the mental health of students, and are there any additional resources that we can provide as a community or that CU can provide to ensure that that CU students feel supported and that they don't feel socially as isolated as I think we are challenging them with right now. So so I guess open that up for discussion too. Is there anything else that we can do to support the mental health of students in our community? And now I will stop my questions and give somebody else a chance. Thank you.
I'll just respond there, Morgan, for a minute, because the way that the step down order is structured did take that into account. We are currently at level C. Once level B metrics are achieved and public health determines it's appropriate to move to level B, that opens up all the opportunities for in-person regulated gatherings sponsored by CU to meet those social needs in a safer, less risky setting with face coverings and social distancing, preferably outside, but it could allow students to get together on a field under CU regulations in those opportunities.
Another quick question, and I may have just missed this. We addressed the athletics. What about in-person class time? Where does that fall on the dial, or is it not a consideration for the rest of the semester?
I can answer that. The in-person learning is not connected directly to those metrics. The idea is that will be a conversation between public health and the university, although I'll let Jeff and Pat speak to exactly the goal with that. And it was not written into the dial for the point that Pat made earlier, is that we have not seen spread connected to classroom learning.
Go ahead, Pat.
So Trina just answered, it's not contained within the definition of a gathering, and we are doing what we need to do to make sure that the educational environment remains safe. We don't anticipate that we're going to have the same density on campus even that we did before the order went into effect, and that we'll continue to have classes that are both being offered remotely and some in-person experiences for the students who are continuing to remain part of the community.
Morgan, any other questions?
Thanks, Greg. Hold on, let me look at my notes. But feel free, anybody else, to jump in there.
Morgan, this is Indira. You had some really good questions about the collegiate group homes and the outreach. And I just wanted to share with you that prior to the public health order going into place, there was a webinar that kind of explained isolation procedures and how to deal with isolation and quarantine and best practices. And in addition, the EPI team worked closely with Shauna from communications to develop a collegiate group home checklist. So it was a prevention checklist. And then in addition to that, our long-term care facility group, our EPI group, who handles a lot of infection control prevention for the long-term care facilities, did outreach to collegiate group homes and had them work on infection control plans. So the problem is that we couldn't mandate it at the time. Some were voluntarily participating in that and some chose not to. And so what we're trying to do is build on all of those experiences that we've been doing and set them up for success. And that's our goal, is not to bring something brand new. It's to build upon all the work that we've already been doing and make it a collaborative process. But we also feel like we have to have some level of accountability built in to ensure that people are participating in the active testing, contact tracing, case investigations, so that we don't have to experience a surge like this again. I hope that helps.
It does. Thanks, Indira. And I mean, again, I just thinking about myself in that age group and thinking about, sometimes it takes more than one contact or, more than the initial outreach to really get things moving and implemented. So I appreciate the ongoing efforts of staff to really try to support students in meeting those goals to be able to move off of that list.
Hey, Morgan, I'd like to give Chana an opportunity to comment here too, because there's been a ton of work that's been done. And we also do have standing weekly hour meetings that CU sponsoring that we participate in with parents, students, and staff to answer questions. But Chana, do you want to add anything?
I'm not sure what you want me to add. The only other thing I would add is that CU and the City of Boulder have put together restorative justice sessions, which have been really helpful. It's students with community members, and also when we can, a member of public health, to have conversations about the impact of COVID on everyone. And I was able to attend one of those, and it was transformational, I have to say. So I think that's also a really important piece in place. We are also looking about ready to launch a marketing campaign for this age group, and a lot of that will be mental health language, social support language, how to have conversations, those sort of things as well. So we're hoping to sort of have a wraparound approach for everyone.
Awesome. And I also want to say, you know, again and again and again, I so appreciate how much time all staff have been putting into our community's response. I mean, I know I see you all so busy with meetings all over the community all the time, trying to answer a lot of questions and a whole spectrum of our community and how they feel we should be responding to this. So, you know, every opportunity I get to say thank you for all of the time and energy you all are putting into this and your work with community. I want to say it again. So thank you. One more question just about, I think I heard this, but I just want to make sure I heard it correctly, that so the metrics will be evaluated on a weekly basis in terms of how often we'll look at the metrics to look at whether or not it's appropriate to move to the next stage.
So I'll take a shot at answering that, and I would want Trina to validate this for me. But we'll be looking at the metrics frequently. We're going to update our website. We haven't decided on exactly the frequency at this point, but we'll be watching those metrics closely, not just once a week, but we'll be watching them throughout the week to see if we need to make adjustments in any strategies. A formal evaluation after the first evaluation that Kate and Trina mentioned would be then once every 2 weeks. Is that correct, Trina?
That's correct. We will commit in the order to updating the website once per week, and then a formal evaluation every 2 weeks. Of course, I suspect the folks at Public Health will be monitoring it far more frequently than that, but just so the public is aware, those are the minimum timelines that we'll put in the order.
Any other questions from any of the other board members? Okay, I don't see any, Jeff. So what is our official action being requested?
So we need the board to approve to support us issuing the 2 orders that we just presented to you. So that would be maybe an action on each one of those. And then we also need, my request is to make sure that we have the ability to move between those levels without coming back for board approval on that, and that we have the opportunity to make amendments to those orders as necessary based on feedback we're receiving and changes we would need to make.
So 2 items each individual for the 2 orders, then 1 item to be able to amend and move within, correct? Or is that just all part of each item?
Trina, do you have any suggestions here?
I propose that you vote on the 2 orders, and each order, the vote would be for the ability for Jeff to pass the order as well as amend the order through the time period for those respective orders.
Okay. Do the board members have the titles of the orders in front of them?
Trina, do we have the title orders?
The first order is public health order. I actually don't have the number. Rita might have that. Probably 08, limiting gatherings.
I think it's on here, 2020-07 and 2020-21. Is that right?
I see it as what was just posted, the Public Health Order 2020 for Collegiate Group Homes in the city of Boulder.
Yep, I just dropped that in the chat, in that we'll still need to have a final number assigned, but that is the title of the Collegiate Group Home Order.
And is the first order the Appendix C?
No, Appendix C describes the mitigation plan as a whole. The orders are part of that mitigation plan, but they're their own separate public health orders. And I will drop in the chat the gathering public health order, which I discussed, and then you can vote on those.
Okay, thank you.
Okay, so I don't think we have any additional comments from the board members. So let's start with the first Public Health Order 2020 for Collegiate Group Homes.
Greg, did we mention at the beginning of the meeting about the potential of opening back up public comments? I don't know if you want to, since we had no public comments at the beginning, I don't know if there's any reason to open that up.
It's a good question, Morgan. I mean, technically we're not required to. And you know, usually we reserve that for the beginning of the meetings. So does the board, I mean, do we want to just request to see if there is any?
I think it's worth opening up. Just
okay.
I lean towards having more input than less, but
Okay.
maybe putting a time limit on it.
We're not required to, but we're also it's our option too. So seeing that we have a couple if we will open up public comment on the items that have been discussed. If there is public comment, raise your hand or put a short note in the chat.
Greg, this is Megan. I believe the individuals here are calling in on their phones they won't have an opportunity to put anything in the chat or raise their hand. And I just want to remind everyone on the call to unmute yourself. I believe it is *6.
And it's, again, limited to 3 minutes. So if anybody's on the phone or on Teams or however you're accessing this, if there is a public comment, please introduce yourself.
Hi, I have a question. I'm a Boulder resident. I'm John Halpern. Can you hear me?
Yes, we can. Go ahead, John.
Yes. Yeah. Thank you for all the information today to start with. I'm a little confused about the off-campus testing. I understand that the university is testing the students through the health center on campus, and there was some talk about opening it up to 600 additional testing capability for off-campus students. But can the CU and Boulder County folks just clarify what the regimen will be going forward to monitor the cases from off-campus students in addition to the on-campus?
So this is Pat O'Rourke from CU. We have the capacity to do that 600 tests per day, 450 at UMC and 150 at the Seek building. We will be tabulating the results for the off-campus students who are testing, who are not part of the on-campus protocol, to be able to monitor the rate of an incidence of infection in that population.
And that's voluntary from the off-campus students, or
It
is
is
there going to be any sort of mandatory testing?
It is voluntary.
Right. And I guess that really is the source of my question, is that you know, how do you compel that, and are you really getting a good sample from the off-campus you know, infection spread, of the off-campus infection spread? Anyway.
And this is Kate Haywood with the Boulder County Attorney's Office. I will add that with respect to the collegiate group home residents, as a part of their mandatory assessment process, there is a requirement for residents of those facilities to participate in weekly surveillance testing at CU unless they have tested positive for COVID-19 in the preceding 3 months. So there is a mandatory surveillance testing requirement for residents of off-campus collegiate group homes in the proposed order.
And just a reminder on the public comment. So public comment, you're free to make your comments, but it's not necessarily a dialogue. If there is a question in that comment, it may be addressed on this call, or it may be just part of the consideration for the decision that will be made.
Andrew Schwartz here. I'm a member of the public and CU student. I had a question for Trina, and I guess I can also comment on this personally, but previously you mentioned that one college-age student and 2 parents meeting together would be okay under the new order, but 2 college-age students and 2 parents would not be allowed. I guess, are there plans for communicating what is and what is not allowed for these types of scenarios in connection with these orders? And I'm asking because as a student, there's often problems with clarity regarding these types of edge cases, and I think if there was a communication sort of aspect along with the order, I think that would be very helpful from a student's perspective.
Would the board like me to respond?
Yes, Trina, you can respond.
Sure. So that wasn't completely correct, and I apologize if I misspoke. The limitations on the number of 18 to 22-year-olds gathered together. So one student or one 18 to 22-year-old and 2 parents would be okay. You look at the number of 18 to 22-year-olds, not the number of other people. And in terms of clarity, currently Boulder County Public Health has published on its website guidance pertaining to the current public health order. That is the best source of information for all of these types of questions. We will be updating that guidance along with the public health order to answer questions exactly like that. We do monitor the questions that we're getting, and we will issue guidance when we see a lot of the same question or just really very good questions.
And the website will be updated only after the order is approved.
Understood. Thank you.
Any other comments? Okay, thank you everyone who did weigh in. Those were good questions and comments. Okay, so now we are ready to discuss or make motions on the board regarding these 2 orders.
This is Brooke. I can move to approve the Public Health Order 2020, limiting gatherings involving persons aged between 18 and 22 years in the city of Boulder.
This is Landry, second.
Okay, we have a motion and a second. All in favor? Aye.
Aye. Aye.
Okay, looks like we have everybody weighed in, so that motion carries. Brooke, would you like to lead
sorry.
us off on the other one?
Yeah, this is Brooke again. I move to approve Public Health Order 2020 for Collegiate homes, group homes in the city of Boulder.
I second. This is Jorge de Santiago.
Okay, motion and a second. Any discussion? All in favor?
Aye.
Okay, that motion also carries. Now I think we need one motion for public health to be able to make modifications based on the data without necessarily coming back to the Board of Health. Does that largely capture it, Jeff?
Other amendments as well. So we had multiple amendments that we had to do last time that would have caused us a huge delay if we had to come back each time.
And so does this, okay, 2 weeks ago when we approved the original orders, we said we would come back, and that's this meeting, to approve the extension. Will there be that need to do that again? Or does this now allow you to make those adjustments and amendments going forward?
It does. I would confer with Trina here just to make sure I'm on the right track.
So the request is, we have this general structure which we've presented to the board, and the request would be to allow Jeff to make modifications, amendments within that structure, and to come back to the board in December for an evaluation of whether we should continue that structure. The types of modifications we're making are just unintended consequences, things we may not have known about and that were brought to our attention. You know, they're not big overall structural changes, but just to address little issues that pop up here and there. And so that would be the request, to allow those modifications to promptly and efficiently dispense with those issues as they come up.
Thank you, Trina. So it sounds like that's pretty self-explanatory. You know, I'll just say that seeing how quickly things can rise and fall in the matter of, 1 to 2 weeks, I think this is kind of a necessary, it's necessary for the department to have this flexibility. And if there are other comments from the board, please make them. Otherwise, if somebody could make a motion, that would be wonderful.
This is Morgan. I move to allow public health to make modifications and amendments within the order structures through December. And I'm sorry if there was an end date in December. I can include that in the motion.
This is Landry, a second.
Jeff, is there an effective date in December?
We can say the board meeting. I think that works well. That way it's scheduled on a normal schedule, and we will come back and report on it at that point.
Okay. I think that, yeah, I think that's good clarification. Okay, we have a motion.
Landry seconded.
Okay, motion and a second. All in favor?
Aye.
Aye.
Okay, that motion also carries. Jeff, do you want to wrap us up?
Yeah, I just want to say again, thank you to board members. This has been obviously a really challenging time for us, and I want to thank, there's many staff on this call who've worked really, really hard for a lot of hours over these last several weeks in conjunction with our partners, and we couldn't have done this without them. And I just appreciate each and every one of them very much. We've got a great staff here, and that's really important for you all to know. Also want to thank our partners who, again, We're not going to see a huge change in this if we don't have collaborative supports between our 4 agencies, county, university, City of Boulder, and Boulder County Public Health. And last, I just want to thank again the students, because even with our collaboration and support, it really does come down to individual behaviors. And I know the students have taken this seriously, and they want to be a part of our community and are a part of our community. And I really appreciate that the actions have followed the strategies that we've put in place. So just a very big thanks to anyone who's tuned in here and listening to that. And finally, thank you to the board for the support.
Okay, thank you, Jeff. Keep up the good work, everyone. I know this is extremely fluid, and we're entering a pretty concerning time of year. So let's do all we can and follow the students' lead in really kind of trying to make this as safe fall and winter as possible. So thank you, everybody.
Thank you.
Okay, meeting
Thanks,
is
all.
adjourned. 2:26 p.m.